Hello. In this video, we will review 3 Pocket Prep paramedic practice questions, answers, and explanations. Follow the prompts along the way to study at your own pace. After each question, there will be a 5-second pause. During this short break, you should pause, answer the question independently, and resume the video. Let's get started.
Question 1. While on scene with a 70-year-old complaining of chest pain, what is one of the first indicators that should alert the paramedic to the probability that an acute myocardial infarction is occurring? The correct answer is option B. The presence of persistent chest pain not relieved by nitroglycerin therapy. Let's review the incorrect choices first. Nitroglycerin is a medication that works by dilating the blood vessels, which can help reduce chest pain caused by angina. It is important to note that nitroglycerin may also relieve pain in the case of a heart attack, but it does not address the underlying issue of blocked coronary arteries. Relief of pain with nitroglycerin does not rule out an AMI. It can still occur in patients experiencing a heart attack. This cannot be a specific indicator that differentiates between angina and an AMI. Oxygen therapy is administered to ensure the patient has adequate oxygenation, especially if they are hypoxic. However, chest pain that is unresponsive to oxygen therapy does not specifically indicate an AMI. This scenario could occur in various conditions and is not uniquely suggestive of a heart attack. Oxygen primarily supports overall cardiac function and health, but doesn't specifically alleviate the pain caused by a myocardial infarction. Cyanosis indicates poor oxygenation in the blood and could be a sign of several respiratory and cardiovascular conditions, but it is not specific to AMI. Cyanosis might be seen in severe cases where the heart is failing to pump efficiently, but it is not an early indicator of a heart attack. Persistent chest pain that is not relieved by nitroglycerin is a significant indicator of an acute myocardial infarction. In the case of AMI, the chest pain is typically severe and crushing and does not subside with medications that usually alleviate angina pain. This happens because the cause of pain in AMI is the death of heart muscle tissue due to prolonged lack of oxygen supply, which cannot be mitigated simply by vasodilators like nitroglycerin. When chest pain does not resolve with nitroglycerin, it suggests that the issue might be more severe than simple angina, prompting immediate, aggressive intervention and further diagnostic testing, such as an electrocardiogram and cardiac enzymes. Question 2. You are dispatched to the scene for an 80-year-old male complaining of difficulty breathing and chest pain. The patient is diaphoretic and lethargic. Auscultation reveals crackles in bilateral lobes. The patient's blood pressure is 223/128. Which of the following is the most appropriate treatment for this patient? The correct answer is option A. Nitroglycerin and CPAP. Let's review the incorrect choices first. Albuterol is a bronchodilator primarily used to treat respiratory conditions involving bronchoconstriction, such as asthma or COPD exacerbations. In this case, the patient's primary issue does not appear to be bronchoconstriction, but rather fluid in the alveoli. Thus, albuterol isn't directly addressing the likely root cause, heart failure or acute pulmonary edema. Continuous positive airway pressure, or CPAP, helps to keep the airways open and can be effective in reducing pulmonary edema by increasing intrathoracic pressure and decreasing the work of breathing, which is helpful but, combined with albuterol, might not target the underlying problem optimally. While nitroglycerin would help by reducing preload and afterload, thereby helping to manage heart failure symptoms and chest pain due to ischemia, the use of albuterol could be unnecessary and may not provide any added benefit in this scenario. Oxygen is beneficial in treating hypoxia, a condition this patient likely has due to poor oxygen exchange from pulmonary congestion. However, solely providing oxygen and albuterol misses addressing the likely underlying cardiac issue directly. Nitroglycerin is a vasodilator which can help in this scenario by dilating blood vessels, hence decreasing cardiac preload and afterload. This reduction can significantly help a heart struggling with increased fluid volumes and pressures as suggested by the symptoms. This can alleviate chest pain from ischemic heart conditions and help manage heart failure. CPAP assists in keeping the airways and alveoli open, reducing the effort needed to breathe and increasing oxygenation. It can also indirectly reduce preload by increasing intrathoracic pressure, thus assisting the heart in this high-pressure scenario. Question 3. Which of the following medications may be used in the management of bradycardia in an adult patient? Select the 3 answer options which are correct. The correct answers are options A, C, and F. Let's review the 3 correct choices first. These are the medications that can be used to manage bradycardia in adults. Atropine is an anticholinergic drug that works by inhibiting the parasympathetic nervous system, specifically by blocking the action of the neurotransmitter acetylcholine at the vagus nerve. This increases the heart rate by preventing vagal effects on the sinoatrial node, which is highly effective in treating bradycardia that's due to vagal stimulation or primary AV nodal dysfunction. Epinephrine acts as a stimulant for both the alpha and beta adrenergic receptors in the heart and throughout the body. It increases heart rate, cardiac contractility, and conduction through the AV node. It is used in bradycardia when the response to atropine is inadequate, particularly in severe cases like cardiac arrest scenarios, where bradycardia is accompanied by hypotension. Dopamine is a catecholamine that, at low to moderate doses, can stimulate dopaminergic and beta-1 adrenergic receptors, leading to increased heart rate and myocardial contractility. It is particularly useful in treating bradycardia with hypotension as it also has vasopressor effects through its action on alpha-1 adrenergic receptors. Phenylephrine is a pure alpha-1 adrenergic receptor agonist used primarily for its vasoconstrictive properties to increase blood pressure. It does not directly affect heart rate and can actually cause a reflex bradycardia due to its vasoconstrictive action increasing blood pressure and stimulating the baroreceptor reflex. Adenosine is primarily used to manage supraventricular tachycardias, SVT, especially because it can temporarily block the AV node and reset the heart rhythm. However, it actually slows the heart rate temporarily and can cause a pause in cardiac activity, which would exacerbate bradycardia rather than help manage it. Cardizem is a calcium channel blocker used mainly to reduce heart rate in cases of atrial fibrillation and atrial flutter and to manage hypertension. By blocking calcium channels, it reduces the force of the heart's contractions and slows the heart rate, which is counterproductive in the treatment of bradycardia.
Click the link in the video's description to download EMS Pocket Prep and study any of our 7 EMS exam offerings. Pocket Prep is a mobile, quiz-based study platform designed to provide effective, engaging, and affordable study material for a wide range of certification and licensure exams. Download the app and get started studying for free today.